In this video, I'm gonna take you through my 4-step FFFR framework I used to make over $100,000 my first year in home health back in 2013, and it's the same framework I would use today and that I teach my therapists in my home health accelerator. And this is the exact framework one of my recent clients just used to make nearly $40,000 in a single month as a solo physical therapist, and another client recently made $11,000 his first 4 weeks ever doing home health. And this is the strategy for anyone that wants to be a contractor or a paid per visit employee, and also a contractor as a supplement. Now, the important thing about this 4-step framework is that you go in order and you do not skip steps. So the first step, the first F, stands for fill. This means filling your schedule. This is the most important thing you do first. If you hold out negotiating for an extra $5 a visit and it takes you a month longer to get that contract, I recently did this calculation. It will take you 16 months to recoup that month's worth of not treating patients. So it is imperative before anything else, you fill your schedule, and holding out for a couple bucks will really cost you way more money than just getting going as fast as possible and seeing patients all day. Here's a few ways you can fill your schedule. First thing is becoming what I call the go-to therapist. This is the preferred therapist that agencies send referrals to first. You can temporarily expand your territory by saying yes to a bunch of referrals. You can market assisted and independent living facilities. You respond to referrals quickly, but the thing that will fill your schedule the fastest by far is contracting with what I call the right home health agencies, which means ones that actually have a lot of patients in the areas that you want to treat. It took me 8 years to figure out a secret way to identify how to find the right agencies, and it's the first thing I take my clients through when they join my home health accelerator. On our onboarding Zoom, I use this technique to create a list of the exact agencies that can quickly fill my clients' schedules. Now, until your schedule is full, 100% of your focus needs to be on getting more patients. Like I said earlier, you can worry about rates a little bit later, but holes in your schedule will cost you more money than a non-optimal rate ever will. So that's our first step. The second step, the second F, stands for fulfill. At this point, you've accepted a lot of patients, and now it's time to perform, right? This means fulfilling on your promise of excellent care to both your agencies and also to your patients. This is how you become the requested therapist from patients so that agencies want to use you more. This is the way we prove to an agency that if they send you a patient, it's not going to be a headache for them. Now, here's some ways you can fulfill on your promise. Show up on time, provide great treatment, educate, give the patient a home exercise program, get your notes in on time, excellent communication with the agency, act and dress professionally. Now, my company hired therapists that accepted 1 million patients right out of the gate, but then they didn't see them promptly, or they didn't get their notes in on time, or there wasn't a signature on the note, or they didn't communicate well with our office. And if that's the case, we stopped using them because they didn't fulfill on their promise. So that's why it's a really important second step. Third step, third F, okay, stands for filter. At this point, your schedule is full. You've proven to your referral sources that you're reliable and they should continue to use you. Now, and only now, you're in a position to start to filter and prioritize which agencies you work with and which referrals you accept. There's a bunch of ways you can filter, and this really comes down to you, your preference. What matters most to one person doesn't necessarily matter most to the next. So these are some ways though: by the territory of the referral, by which EMR that agency uses, the company policies, how do they pay, the schedule, is it via direct deposit, is it via check, what's your rate, does that company make you feel supported, is there mentorship, and literally anything else that matters to you and that you care about becomes part of your criteria for filtering as the third step. Now we're going into the fourth step, the one that everyone wants to rush to, the R, which stands for raise your rate, okay? At this point, your schedule is overflowing, you're fulfilling on your promise to your patients and your referral sources, and you've been filtering which referrals you accept. Only now do you start raising your rate. If you do this too early and you don't get the rate approved, or you rock the boat and you get less referrals, it may send you back to step one and leave you with open holes in your schedule. Now, there are other therapists that teach strategy on raises, but my perspective is super unique because it's been both as a therapist that I've done this, as well as a company owner who's hired over 650 therapists and been on the other side of the table. And as the employer, putting on my employer hat, I'll tell you, if you ask for the raise too quickly or in a way that turns off your employer, which unfortunately a lot of people are kind of teaching you to do at this point, you may get the rate increase approved, but it's going to be at a cost, which is at the first opportunity, that company's going to replace you. And that's why it's so important. You must wait for steps 1 through 3 to be complete and have enough referrals that it won't affect you if they do send you less referrals. And I know pricing strategy is a hot topic, and there's a full section in my Home Health Accelerator dedicated to it, along with my Get a Raise email template that I've used well over 50 times with over a 96% approval of my rate increase request. So if you're into pricing stuff, make sure you subscribe to my YouTube channel. I'm gonna make a video on this in the future. And if you are looking to get into home health or get your schedule busier, increase your compensation, or even start your own home health therapy company, I'm gonna go ahead and drop a link down below. You can click it and schedule a 100% free strategy session with me. I'll do an audit where you're at, where you're trying to go. I'll let you know if I can help, and if I can't, I'll at least point you in the right direction.